Hello, my name is Michele. I'm a licensed massage therapist in Washington State, and I bring you MBLEx resources, that's Massage and Bodywork Licensing Exam, study guides, practice tests, lots of videos here on YouTube. I've got ebooks going over all the sections of the MBLEx, and I have some wonderful courses, including my favorite, my baby, my 90-day MBLEx refresh course. So if you have 30 days until your test, or if you have 60 days, you can do it twice, or if you have 14 days, you could do it double time. But it will take you through everything necessary for you to pass the MBLEx. And it's an audio course, plus it's got workbook pages to give you extra activities if you need to dial in some aspects of each section that we go over every day. So if you want to not have to think about it and just know that you're going to pass, get that course. But right now I'm working on a big mega course. It's a huge deal for Anatomy and Physiology for Bodyworkers, and part of that is the skeletal system. So this video and the video right before that is a supplemental section to add to the skeletal system that has to do with just knowing the bones that are important for bodyworkers and their landmarks. That is specifically like the muscles, the nerves and blood vessels going through a bone, right? So if you caught that video, I'll just go ahead and put that little picture of it. There'll be a link for it in the description. Also going along with that is a wonderful atlas that I created, a PDF resource, absolutely free. That will also be linked in the comment and in the description. So look for those so you can get a hold of those. But yeah, for right now, we're just gonna do some questions, MBLEx style, multiple choice questions, going over all that information that we did in that previous video before we go into the rest of the skeletal system. So let's see here. Let's go ahead and get started. During a massage, a therapist palpates the bony ridge just inferior to a client's neck and uses it as a reference point to assess shoulder alignment. Inferior to the client's neck, and uses it as a reference point to assess shoulder alignment. Okay, so we're inferior to the neck. I'm assuming that that's going to be the anterior part. So because let's see, we have the spinous process that's in the posterior area. This is a confusing question. Acromion process of the scapula, which is, get my hair and stuff out of the way. The acromion process, that's here. I was thinking about the coracoid. So we got the acromion process, which is the pointy point of the shoulder. We've got the spinous process of the seventh, a landmark right here on the back of the neck. It's a bumpy bump on the back of the neck. We've got the manubrium of the sternum, which is in the center, and the superior angle of the scapula, which is up here. So let's see, the acromion is on one side, so you would only be able to check the balance relative to the other side. The manubrium is in the center as well, which is like the first part, but I don't know how much that would have to do with the shoulder. And then the superior angle of the scapula, you got two of them. So once again, just like the acromion, and like anything that you use for checking the balance on one side is just going to be relative to the other side. So I think what the question is trying to ask is a specific landmark on the neck instead of the shoulder or the sternum. So I'm going to go with B, spinous process of the seventh cervical vertebrae, because it is the big bump on the back of the neck right there. Okay, so let's go ahead and see. B. Okay, that's what they said. C7 is the most palpable spinous process at the base of the neck and a key landmark for orienting the shoulder girdle. The acromion lies laterally on the scapula, laterally on the scapula. The manubrium is anterior on the chest, and the superior angle of the scapula is deeper and less prominent in position. So it's back here. Okay, next question. A client reports pain when raising the arm overhead. During the assessment, the massage therapist palpates the bony prominence at the lateral tip of the shoulder where the clavicle meets another bone. Which structure is being palpated? So if you're going to palpate your shoulder bone, right? So we start here in the center, that's the manubrium of the sternum, and then we go outward. That collarbone, that's called the clavicle. So we're going to go farther lateral. Lateral is on the outside, medial is on the middle. So we're going to go farther lateral until that clavicle meets with some bone over here, right? What bone is that it joins with? Is it A, the acromion? So it would be the acromioclavicular joint. Is it B, does it connect with the coracoid process of the scapula? Now, from what we remember from the last video, the coracoid process doesn't connect with any other bones. It only connects with muscles. The greater tubercle of the humerus, which is way over here. And then the glenoid cavity of the scapula, which is your arm socket. All right, so I'm going with A, acromioclavicular joint, because the acromion and the clavicle come together, and when we name our joints, we're talking about the two bones coming together, acromioclavicular. Okay, yeah, the acromioclavicular joint connects the lateral clavicle to the acromion process of the scapula and is a common site of strain or separation. The coracoid process lies anterior and deeper. The deeper tubercle is on the humerus just below the acromion, and the glenoid cavity is the shallow socket where the humeral head articulates. All right, next question. Which of the following statements about lower limb bony landmarks is not correct? Not correct. So this is an important thing when you're doing your MBLEx questions, is to figure out in the question, what do they want you to do? It's a direction. They give you information and they give you a direction of what to do with that information. And in this case, they're not looking for the best answer. They're looking for the one that's not right. So there are going to be 3 correct answers and there's going to be 1 wrong answer. Okay. Lower limb bony landmark facts is what we're looking for. We're looking for the not fact. So A, the greater trochanter of the femur. Greater trochanter of the femur serves as a major muscle attachment site and is easily palpable on the lateral thigh. That is a true statement. Okay. B, the tibial tuberosity is the attachment point for the patellar tendon and can be felt just below the kneecap. That is a true statement. The medial malleolus of the fibula forms the inner ankle and provides attachment for several ligaments. Let's look at this again. The medial malleolus of the fibula. So if we reach down to our ankles, I can't really demonstrate right now because of the angle. I don't want to mess with my camera. The medial malleolus is the bony sticky outie of your ankle in the center as you're going around the medial side of your foot. So that would be the medial malleolus. Is that the fibula? Because the fibula is on the lateral side of the lower leg. So it can't be that. So C has to be wrong. And then just to clarify, just to make sure, D, the calcaneus forms the heel and anchors the Achilles tendon, which is true. So it has to be C. C is the wrong answer. Okay? The medial malleolus is part of the tibia, not the fibula. The lateral malleolus belongs to the fibula and forms the outer ankle. The other statements correctly describe the palpable and clinically important landmarks of the femur, tibia, and calcaneus. Okay, which of the following landmarks is correctly matched with the bone on which it's found? Okay, so we're looking at some bony landmarks and associating them with the bones. So we know that there's only going to be 1 correct answer in this case. All right, find the correct connection. Coronoid process is on the scapula. Coracoid process is on the scapula. Coronoid process is on a few other different bones. Olecranon process is on the ulna. Lateral epicondyle located on the radius. Let's see, lateral epicondyle, let's see. Let me just make sure. So radius side and ulnar side. So that's, ulna, radius. And so if we go into our anatomical position, we're going to, so there's the radius on the thumb side, and that's going to be lateral. That epicondyle is going to be lateral, so that's a true statement. Styloid process located only on the humerus. That's an incorrect. Incorrect, okay? So coronoid process, olecranon, no wait, okay, so lateral epicondyle is on the radius, that's the thumb side. Uh-oh. Which one is it? Okay, I thought that C was correct and B was correct. All right, so let's see. Uh-oh. Oh, I didn't put the answer in there. Ah! I must have lost it in when I was formatting everything. Oh dear. Let's go ahead. That's funny. Let's go ahead and put in the comments what you think the correct answer was for that one, because I lost it. I think they're both true. Let me see. So the radius is the pointy finger side, and that would be lateral. So I think B and C are both true. They will not trick you like that on the MBLEx. All right, so that's my bad. Sorry, guys. A massage therapist is reviewing surface landmarks to improve palpation accuracy. Which of the following landmark bone pairings is correct? Okay, landmark and bone pairings. So that's just like the last one. I hope I put the answer in. Let's just go ahead and do it. Okay. Iliac crest is part of the pelvic bone. Oh, which is incorrect. Look at that. I almost did it. I almost fell for it. Which is incorrect. All right. So yes, that's correct. Iliac crest is part of the pelvic bone. Manubrium is the superior portion of the sternum. That's true. Spinous process are the posterior projections of the vertebrae, the back sticky outies. That's true. Xiphoid process located on the superior is closer to the head, superior end of the sternum. Not true. Xiphoid process is on the base of the sternum. All right, that one was way easier. Okay, and now I have the answer. Okay, yeah, sorry about that last one that I put 2 correct answers in there and then didn't write the... Okay, so which of the following statements about the skull and its landmarks is accurate? So we're not looking for the inaccurate one, we're looking for the accurate one. Okay, skull and its landmarks. The occipital condyles articulate with the atlas, C1, to allow nodding motion in the head. Occipital condyles? Do we have occipital condyles? I didn't go over that in this video. Well, this is interesting. Okay. B, the zygomatic arch forms part of the cranial cavity that houses the brain. No, the zygomatic arch is a facial bone. It serves as attachments for our facial expressions. C, the foramen magnum is located in the temporal bone near the ear canal. No, foramen magnum is the big hole for our spinal cord to go into our brain. So that's not correct. And D, the sphenoid bone is a superficial facial bone that protects the nasal cavity. No, not true. It is deep inside our face. Under all this facial stuff, the sphenoid bone is way in the center. Check out that video, we'll talk about it. But so even though I didn't talk about the occipital condyles articulating with the atlas, I did mention that it does, like the skull sits there. So I'm thinking A. So you can really get a lot out of figuring out which answer it's not. So that's when all else fails and I don't know the answer, I go for the one that makes the most sense, the best one. And that's what we got here. The occipital condyles, located on the underside of the occipital bone, form the atlanto-occipital joint. That's the atlas and the occipital joint. Occipital bone and the atlas form the joint. With permitting flexion and extension, that's yes. Or in India, yes. The zygomatic arch is part of the facial skeleton. The foramen magnum is in the occipital bone, not temporal. And the sphenoid is a deep cranial bone forming part of the skull base, not the outer face. Okay, which of the following statements about the carpal bones is correct? Those are the bones that join your wrist to your metacarpals. A, the pisiform and hamate are located on the thumb, lateral side, as we're doing anatomic position. Pisiform and hamate are on the lateral side of the wrist. B, the scaphoid and lunate articulate directly with the radius to form part of the wrist joint. Scaphoid and, I like that one because I do know the scaphoid and lunate are going to be more proximal, and then the trapezium and trapezoid are located in the proximal row. I don't think that's true. The capitate and hamate form the distal ends of the radius and ulna. So let's do our mnemonic. I have something here. Whoa, went too far. Okay. Sally left the party to take Kathy home. And this helps us to memorize this. So Sally, starting with the scaphoid here. Sally, and that's the thumb side. We're starting at the thumb side, which is lateral, and we're moving toward the medial side, more proximal, okay? So the first row is 4 bones. Scaphoid, that's left, lunate. The is triquetrum. Party is pisiform. So Sally left the party. And then more articulating with the metacarpals. So all those 4 that I just listed articulate with the radius and ulna. And then the second row it's going to be more distal. So that's trapezium. We're going to start back on the thumb again. Trapezium, trapezoid, capitate, and hamate has got that little hook. Hamate has the hook. Pisiform has the sticky outie that we can use for body work. Also, another mnemonic is some lovers try positions they can't handle. If you can't remember, Sally left the party to take Kathy home. It's a little more risque, little dirty one. So that can help you. Some lovers try positions that they can't handle. All right. So let's go back to the question again, even though you got a little... Let's go back to the question. What? Uh-oh. Screw just fell out of my chair. Okay. Back to the question. The pisiform and hamate are located on the thumb side. No. Hamate and pisiform are all located on the pinky side because we just did some lovers try positions. Okay? And then that's wrong. The scaphoid and lunate articulate directly. Let's see. Scaphoid and with the radius, which is the thumb is on the radial side. So I like that, B. The trapezium and trapezoid are on the proximal row. That's not true. The capitate and hamate form the distal ends of the radius and ulna. So hamate and capitate are both going to be on the second row. So that's not true. So it's got to be B. Okay. All right. And there's the explanation there. If you want to take your time and read through that, there it is. Okay, skipping that. Next question. Which of the following statements about bones of the foot is accurate? Okay, so there's going to be 3 wrong answers and 1 correct one. Bones of the foot. The talus forms the heel and serves as the attachment site for the Achilles tendon. That's A. A. The talus forms the heel and serves as the attachment site for the Achilles tendon. In another question earlier, we were talking about a true statement, that being that calcaneus forms the calcaneal or Achilles tendon. So A is not correct. B. The navicular articulates with the metatarsals to form the ball of the foot. That's not true. The navicular articulates with the cuneiform bones. And then C, the calcaneus is the largest tarsal bone and forms the heel of the foot. That is a true statement. D is the cuboid is located medially and articulates directly with the tibia, which is not true. It does not articulate with the tibia. It is kind of in the middle of the foot. So C, yes. The calcaneus provides the base of support for the foot and serves as the attachment site for the Achilles tendon. The talus sits above it and articulates with the tibia and fibula at the ankle, and the navicular is medial and connects with the talus to the cuneiforms, and the cuboid lies laterally, not medially, and does not articulate with the fibula, or the tibia, I mean. All right, a massage therapist is learning to identify bony landmarks of the pelvis for client assessment. Okay, landmarks of the pelvis, important. Massage therapist learning to identify, not important. So we want to know about bony landmarks of the pelvis. Which of the following statements is not correct? All right. Ischial tuberosities are the sit bones that bear weight when sitting. Okay, we're looking for not correct. All right, because like right away I got the right answer, and that's when I'm like, wait a minute. Oh wait, not correct. We're looking for the one wrong answer. B, the anterior, superior iliac spines are easily palpable landmarks on the front or anterior part of the pelvis. That's a true statement. C, the pubic symphysis is a cartilaginous joint connecting the two halves of the pelvis in the front. Now, I am going to be talking about the different kinds of joints in the joint video here in a couple more sections. Let me just go ahead and read this third one. The acetabulum is located on the posterior surface of the pelvis, articulating with the sacrum. No. So, the acetabulum is the joint where your hip socket is, your hip socket, essentially, where the femur goes in. So that is not a true statement. Okay. So I'm gonna assume that the pubic symphysis is a cartilaginous joint because that seems close to being true. It's connecting the two halves of the pelvis at the front. So I'm going with D. I'm going to circle D as the incorrect answer. Okay, the acetabulum is actually a lateral depression on each side of the pelvis where the femoral head articulates to form the hip joint. The pubic symphysis are directly described and are key surface landmarks used by massage therapists for orientation and client positioning. Next question. Which of the following statements about the thoracic cage is incorrect? Okay, so we have 3 correct answers and 1 incorrect answer. Ooh, we're really getting a run for our money with the incorrect ones. A, the sternum consists of 3 parts. The manubrium, the body, and the xiphoid process. Those are true. B, the true ribs attach directly to the sternum through their own costal cartilages. True. C, the false ribs, 8 through 12, do not attach to the sternum at all. Or D, the floating ribs, 11, 12, have no anterior attachment to the sternum or cartilage. So let's see. C, the false ribs, 8 through 12, do not attach to the sternum at all. You know, I'm going with that one because this is the way it is. The false ribs, 8 through 12, attach to the sternum through by the cartilage attaches to the cartilage of the 7th rib. And that's why they call them false ribs, because they don't attach. They're down here. You can feel them on the bottom. And as you follow the curve up into where your xiphoid process is, you can feel where they attach to the 7th rib. And then the floating ribs have no anterior attachment to the sternum. They're just hanging in the back here. That's a true statement. So for incorrect statements, C is what I would go with. Okay. Oh, that's it. We did them all. Okay, so if you love this video, give it a thumbs up. Make sure you're subscribed, because if you need to pass, you're watching this video because you need to pass the MBLEx. So just get subscribed so you see all the videos and all the resources that I'm making as I go. But make sure and check out all of the other anatomy and physiology videos that I've been creating. It's part of a series that I'm going to put together into a big course. So watch all of that. The other skeletal system videos are coming right up. And make sure you get your atlas of bones, important bones, and their landmarks in the link in the description and in the pinned comment. So I will see you in future videos. Bye-bye. Toodaloo.